What up guys, welcome back to a new video and welcome back to my channel. Today we're going to talk about the top 5 multi-bagger penny stocks. Now guys, before we begin, I want you to do one thing: smash the subscribe button, actually two things, and like. Only if you found value at the end in this video. Now guys, remember, we only trade pharmaceutical penny stocks for a simple reason, is that we can predict the exact date it's going to spike in value. We can predict when it will shoot up in value or go down in value, generate us profits or make a loss for us, and we know exactly what affects that. Like I said in many of my videos guys, we only trade pharmaceutical penny stocks and we know exactly what affects a penny stock to shoot up in value or down in value. And if you're new to this, let me explain it to you before I move on to the top 5 penny stocks you need to be watching in the first quarter of 2018. That's January, February, March. So guys, penny stocks don't have revenue. Penny stocks don't have products, most of them. And the reason why they're penny stocks, because they're just in the development stage. Now, pharmaceutical penny stocks, they must develop these products. They must generate revenue somehow, right? So they have to develop products, and in order to develop products and improve their pipeline, they have to test those products to see that these drugs and medicine actually work before they have them FDA approved. So what they do is they go through trials, basically trials and errors, tests to see if these drugs actually can improve the disease and treat that disease, whatever they're focused on. The company will release the result of that trial. If that's a successful trial, the stock is going to shoot up in value because investors are going to believe and they're going to have hope in that company, because now it is one step ahead and it's one step closer to actually producing revenue, because now they're going to have a drug that's going to sell and they're going to generate them revenue. If it's negative, then that stock's going to basically slump in value because now that company is one step closer to collapsing, because now they have failed the whole purpose of the company. These penny stocks that I've picked for you guys are vital. Drugs they develop are very important because they deal with diseases that most competition don't even have ready. Basically, there's no drug for them out there in the market, so that's why they're important. Because if that's successful, and basically if that drug is successful, and most of them are for HIV, basically cancer, heart disease, Alzheimer's, leukemia, because that's important. Those diseases, those basic deficiencies are important. And if you're in the pharmacy sector, if you're in the health sector, you understand that a drug like that is going to be important once it's developed. And that's why that company is vital. And just to clarify guys, whatever I tell you here, take it as an advice. Don't take it as a 100% indication that you should buy it. But I want you to do one thing. Look at the trials in the past and look at the stocks and see what happened and how that reacted. And you will see that if a trial is successful, a stock will spike in value. If a trial was negative, comes out negative, it wasn't successful, the stock will slump in value. And basically, if there's 2 trials, one passes and one fails, and they release the news on the same day, that you will see that basically the stock will react differently. So that's when you have a mixed result, then stay on the sideline, don't jump in. But let's begin guys and look at the previous videos, because I did explain it in the previous videos. But let's begin with the multi-bagger penny stocks. 5 penny stocks you need to be watching in 2018, March and in February, first quarter. So the first stock is called ABIO. Biopharma guys, traded at $1.75. Average volume is 200k. Like I said, there is no volume in these penny stocks until they release the trial, until they release basically the success of a trial, and then the volume will jump back in. It will be in the millions. You can see that the target estimate is $16.50, and we're trading at $1.75. So there's a huge potential for increase there and double your money. Like I said, earning per share is a minus figure. Well, because they don't have revenue, so there is no money. It's only expenses for them at the moment until they develop the product. So the trial is going to be basically phase 2B completion of enrollment announced August 16, 2017. Top line data due March 2018. And the data is for the chronic heart failure drug that they're developing. So they're testing the drug for the chronic heart failure and whatnot. So that's important guys. VTVT guys, that is trading at $7.56, and the 1 year target estimate is $17 for that. Like I said, there's huge potential for that. The average volume is around 250k. That is not much, but when they release the trial on the day, that's going to spike in value and shoot up to the moon. Like I said, earning per share is a minus figure. Well, because they're in the development stage, they have no revenue. Market cap will always be in the millions. Anything under 100 million or 1 billion even, it's a low cap. Phase 1 out of 2 trial initiation announced November 8th and 17th. Phase 1B data due early 2018, and that's for diabetes. Now there's 2 trials being released in 2018. Part B is due late 2018, so that's going to be late basically by the end of next year. But the first one is going to be released in the next 2 months, either February or March. So there we're going to have a spike coming. So watch the website, guys, for the release of that article where they say, look, this is the data, here's the news, it was successful. And that's what's going to trigger investors to hop in on the train of that stock and basically spike the volume up. And that stock will shoot up in value on the day. So make sure you watch that stock, guys. The next stock I want to talk about is MBIO. MBIO Mustang is trading at $12.14. Basically, they have a 1-year target estimate of $18. Average volume is 100K. That's very little, but like I said, when the spike happens, it's because of the news, and we'll have millions of people jumping into that specific stock. And just to let you know, the more you share that video, the better, because then we'll have more volume on the day. And like I said, earning per share is a minus, just like anything. Phase 1 data due early 2018, guys. Remember, 2018 early, which means January, February, March. January's gone, so now we have February and March left, so be careful. And like I said, for this stock, there's actually 2 datas being released for 2 different drugs. So that stock could spike twice or could slump twice, or one of each. So watch the website for the news when it comes out, guys. MBVX, guys, trading at 65 cents a share. Average volume 327. 1-year target estimate is $18. Market cap 17 million. So you can see that 86 cents to 18, guys, a target of $18. That's a lot. So I don't know, guys, you can buy 100 shares of those and you'll still come out profitable. 100 shares will cost you €8, and when it does spike to $18, you'll come out with 18,000. So be careful with that, guys. And the last stock I want to talk about is GSK, trading at $38. Now that is not a penny stock. However, they have something coming up for HIV, which is very important and can revolutionize everything. So phase 2B data is likely due early 2018, and that's for HIV. Now, when we have a drug for HIV being developed, if you've never heard of GSK, that's basically the company that develops Panadol for the headaches and whatnot, migraines. Now, we don't need to look at figures because it is profitable, in the profitable zone. But like I said, guys, those 4 stocks I would probably trade. GSK I would probably invest in. However, only take what I say into consideration and don't act upon it until you do your own research. So those are the 5 stocks. I will have them in the description, and let's go back to the main screen so we can actually discuss them. I know only 4 were penny stocks, but one of them is very important because it's a multi-bagger. If HIV drug is developed, then we're gonna have a huge spike in that stock. Regardless, it could go up to $80 and double up. Now look, guys, whatever I say, remember, you take it into consideration, but don't act upon it until you do your own research. I want you guys to do your own research. Now, how do we trade these? Well, on the bell, when we see a positive result, and make sure it's crystal clear, there's no other indication that the stock is going to slump in value. When we have crystal clear proof that this stock is going to spike, not even mixed. We don't want mixed. If they've released 2 datas on the same day, one passes or one fails, we stay on the sideline. We don't jump in. We have to make sure that this data passes. Everything is crystal clear. Everything is just positive, positive, positive. That's how we trade it. On the bell, when the market opens, before the market orders, you have your shares ready, market order, you buy it, and then it spikes, you get in. You can adjust your strategy. Do your own strategy, but I can say 10-20 minutes, take your profit and get out. Unless you want to be greedy, because I know there's going to be a pullback. So that's how we trade it. If you found value in this video, make sure you subscribe, smash the subscribe button, and put the like in, put the comment in, and I really appreciate every single person